Hello, everyone. I'm so excited to be here this afternoon. My name is Karnesha Slaughter. I am a health communication specialist with the Centers for Disease Control and Prevention. And I really am just here to give a brief introduction to Deepa, who was just speaking. She is you all's New Jersey Act Early ambassador. So if you did not know that, now you know you have an Act Early ambassador. I'm going to talk a little bit about our program, and I'm going to speak a little bit about the Act Early ambassadors before I pass it along to Deepa, who will be giving more information in depth around developmental milestones, information about how parents can bring concerns to the pediatrician. And then we also have Dr. Usha Ramachandran, who I'm very excited. I just recently got to meet her today, actually, and just heard a little bit about her and Deepa work together for the families in New Jersey. So, without further ado, I'll just kick off my slides so you guys can hear from them because they are really the main event. So, next slide, please. Yeah. Okay, there we go. All right. So, I'm curious. I'd like to see in the chat who has heard of the Learn the Signs Act Early program. If you have, just say yes. If you have not, just say no. This is an initiative from the Centers for Disease Control and Prevention, as I mentioned. And the goal of our program is to improve early identification of developmental delays and disabilities, including autism, by increasing family engaged developmental monitoring. And so we do that in a number of ways, the main one being by disseminating family-friendly, evidence-based resources that provide information to families about developmental milestones, what milestones children should be reaching by certain ages, and very easy to understand information on what to do next if they have concerns. So I'll talk a little bit about some of the resources that we have, but that's pretty much the gist of our program. Now, some of you may be wondering, why is this something that CDC has as a program? And we can go to the next slide. And I'm going to show a few data points that I'm sure many of you already know. One being that 1 in 31 children has autism spectrum disorder. And just to give a little bit of background, so that 1 in 31 number comes from 8-year-old children across 16 ATOM sites. So the ATOM is a network that we have that does prevalence in different states. So this does not represent the entire US population. I do want to mention that, but from those studies that are done, that is the number, the rate of autism that has been most recently revealed. Boys were more than 3 times as likely as girls to be identified with autism spectrum disorder. I also do want to mention that um, other groups had higher rates, looking at the data. Around 1 in 6 children has a developmental disability. About 1 in 5 children from lower income households has a developmental disability. And then also, data shows that many parents actually have concerns around 18 months. However, as we all know, the average age for diagnosis of autism is around 4 years of age. So that lets us know if perhaps families had some information in their hands that sort of gave them a little bit more of a foothold on those concerns and gave them technical information on what to do to ask questions about those concerns, perhaps that diagnosis could come even earlier. And so what we do know for a fact is that too many children, given the 1 in 31, the 1 in 6, 1 in 5, too many children who do have delays, they're missing the opportunities to be receiving early intervention services before age 3. And so again, our program mission is in the name, learn the signs of typical child development, act early. And one of those things that we say when we say act early is by reaching out to early intervention to ask for an assessment or evaluation. Next slide, please. So again, our campaign strategy really is to integrate that parent engaged, family engaged developmental monitoring into national, state, and local programs that serve parents of young children, that serve low income or disadvantaged populations, programs that have an interest or mandate in child development, could be early child care. We also work with integrating into WIC, into Head Start home visiting as well. And then we also try to integrate into programs that they just simply lack the tools or resources for helping families track those milestones. Next slide. So I realize that I'm saying something that, again, many people may be familiar with, but maybe some are not, which is developmental monitoring. So our program is not a developmental screening program. We are a developmental monitoring program. And so we really want to understand the difference between the two. Monitoring means observing and noting those specific ways that a child plays, learns, speaks, acts, or moves, often used with a checklist of milestones. So it doesn't have to be CDC's checklist, it could be any checklist. And then developmental screening is a more formal process that uses a validated screening tool. So some that many are aware of are ages and stages. For example, and so this is a really nice diagram because it shows the difference between developmental monitoring, developmental screening. As you see where it overlaps, they're both looking for milestones. They are both very important. They really work hand in hand. And a paper actually done by one of our previous CDC fellows found that developmental monitoring and screening together actually leads to more children getting into early intervention compared with developmental screening or developmental monitoring alone. So we really see the two as complementary. Next slide, please. I mentioned our free materials. So we have free customizable materials for state and community programs. And so when I say customizable, that means you can take anything that is on our website. You can reach out to us at actearly@cdc.gov and you can add your agency's logo, your agency's phone number, your agency's website, because we just feel it is as important as possible to get these materials into the hands of families. Again, we are a government agency, so everything is public domain. So sort of think of it as your tax dollars paid already for you to have access to these materials. Um, Again, there's our website, cdc.gov/act early. The materials are research-based and parent-friendly. They can be used as monitoring tools. They include language that encourage and enhance that family provider dialogue. And one of the best things is that not only do we have materials in English and Spanish, we have materials in Haitian Creole, Brazilian Portuguese, Arabic, Somali, Farsi. And we have a host of other languages that may not be on the CDC website, but that potentially partners have translated to and have given us permission to then continue to share it because we all know how important this mission is of identifying children as early as possible. And so we really find these to be useful for any program or practitioner that serves parents of young children or families with young children and has an interest or a mandate in child development. And I am going to put in the chat the website just so it doesn't get lost. Next slide. And so one of the ways that we promote this mission is through our amazing Act Early ambassador. So again, Deepa is our your Act Early ambassador to New Jersey, and she has been for some time, and she is amazing at championing Learn the Signs Act Early amongst the various programs and programs and services that serve families. Our ambassadors are very passionate about early identification, very, very well connected. And again, they're working with a very small stipend to integrate developmental monitoring into programs. So they're doing this because they know how important it is. It's not about what they're receiving, it is about their desire to help. As of right now, we have a network of 64 ambassadors representing all 50 states and Washington, D.C., 3 tribal communities, 1 freely associated state, and 3 territories. So it's a really large network that works together. And so CDC, we are here to help the ambassadors so that they can do what they need to do to help you all. Next slide. I think next is my last one. Okay. And yeah, so this is my email. If you have any questions or would like to contact me, and then we also have a functional inbox. But again, as I mentioned, Deepa is 9 times out of 10, we point people back to the state ambassador. So you likely would be able to get some support from her with any questions you might have. So. And I think that is all for me. Thank you so much for the time.
Thank you, Karnesha. Now we'll hear from Dr. Usha Ramachandran.
Good afternoon, everyone. Let me start sharing my slides. I am thrilled and honored to be here to talk with all of you and especially to present alongside Karnesha and Deepa. As Karnesha mentioned, I have worked very closely with Deepa for many years now, and I couldn't do most of the work that I do without her. So it's definitely a privilege. So to continue the discussion, I'm sorry. So I wanted to just start with talking about something that we all know about, how early childhood is a period of unique opportunity and vulnerability. We know that more than 1 million new neural connections are formed every single second in the early years, and that 80% of the brain is developed by 3 years of age. We also know that the first few years of life are a period when the brain is the most susceptible to external experiences and influences, which provides a great opportunity if those influences are positive, and then provides that vulnerability if those experiences are negative. And so we know from multiple studies that adverse childhood experiences such as abuse, neglect, household dysfunction, and adverse community environments such as poverty, housing instability, experiencing discrimination, and community violence can all have negative consequences, not just in the immediate term on children's development in the moment, but they also have negative impacts on physical and mental health along the line, even into adulthood. But the great news that we've learned from multiple areas in science over the last decade is that there are positive childhood experiences that can have an amazing positive impact on child development in the moment and long term as well. So what are these positive childhood experiences? Most of us are way more familiar with the adverse childhood experiences. So I wanted to spend a minute here to talk about positive childhood experiences just because they have such a big impact on development. So it's 7 things, and central to all of it is feeling safe and protected by an adult in your own home, and then feeling that your family stood by you during difficult times, being able to talk about your feelings with your family, a sense of belonging in school, being supported by friends, participating in community traditions, and having at least 2 adults who are not your parents taking a genuine interest in you. And research has shown that when people experience these positive childhood experiences, they flourish, and those families flourish as well. And the most hopeful and heartening among all the pieces of evidence that have come out about the impact of positive childhood experiences is that they can mitigate the effects of adverse childhood experiences, not just in the moment, but well into adulthood. So this one study conducted by Dr. Bethel at Johns Hopkins was able to show that even in adults who were exposed to multiple adverse childhood experiences, if they had also experienced positive childhood experiences, if they had experienced, for example, 6 to 7 positive childhood experiences in addition to adverse childhood experiences, they had a 72% lower incidence of depression and other mental health issues. So, and just like adverse childhood experiences can have dose-dependent effects on your life, so do positive childhood experiences. The more you experience, the more protective it is, and the more it helps you thrive and flourish. And as you probably noticed in those 7 positive childhood experiences, most of those have to do with relationships. And amongst the most critical of those relationships are the early ones that an infant has with the adults around them. So strong, positive, nurturing relationships with adult caregivers in the first few years of life are vital and foundational for creating healthy developmental opportunities and lifelong health and well-being. Pediatric primary care is positioned to take advantage of the early years because we see children multiple times by the time they reach 3 years of age. There's 12 well-child visits that are scheduled, that are recommended by the American Academy of Pediatrics before 3 years of age. And we get to see families with young children before they reach the school systems, before they reach even Head Start, and so on. And so we're often the first line in terms of promoting development and identifying risks, identifying delays in developmental disabilities, and so on. So the American Academy of Pediatrics, in its Bright Futures guidelines about prevention and health promotion, talks about a tiered approach to promoting early childhood development and early relational health for all our patients. So the primary level, the universal level, is promoting early development and recommending or guiding parents in specific ways to allow them, support them in providing the most optimal conditions for their children to grow and develop, and for them to build those really strong relationships with their children early on. And then the AAP, of course, recommends identifying risks, and we'll talk about that in just a moment, and addressing those risk factors, and of course, identifying delays or disabilities and treatment for that as well. I wanted to take a little bit of time here in giving a glimpse into some of the resources that we use as pediatricians and those in pediatric primary care for promoting early childhood development. I just thought that maybe you might not be as familiar with these resources as we are in the pediatric field, and so I wanted to share these with you. The healthychildrens.org website is a fantastic website that is maintained by the American Academy of Pediatrics. It is completely evidence-based information. And amongst all the medical topics that it covers, it also pays a lot of attention to early childhood development and development in general. There is a section called Ages and Stages, which is broken down by age groups that correspond to the World Child Visits. And you have the QR code here if you wanted to take a quick peek at what that site offers. And so there is a lot of guidance for parents on promoting development, early signs of developmental disabilities, and so on. And so this is a great resource for parents that I often recommend to the families that I serve. The other resource that I use a lot is the Mount Sinai Parenting Center, a fantastic resource for especially early childhood materials. I specifically love their Sparks parent videos that are part of that website that are available to anybody, to all parents. And there is a lot of anticipatory guidance and health promotion, lots of information of relational health and early childhood development in those videos. They're available in English and Spanish, but a lot of their other materials are available in other languages as well. And then, of course, Reach Out and Read. Full disclosure, I'm medical director for Reach Out and Read New Jersey, and early childhood literacy and early childhood development in general are big areas of interest of mine. And Reach Out and Read New Jersey has a number of free resources for families as well as providers. Wonderful tips on reading together, book lists, high quality book lists for helping families deal with specific situations, etc. And I wanted to take a moment here to talk about the power of shared reading in promoting early childhood development. We think about reading and early reading aloud with children as contributing to their literacy development and maybe school readiness and language development. But there is so much more that happens when an adult and a child just cuddle up together, share a book together, do that dialogic back and forth reading where the child is an equal participant and have fun around books. So much happens in those moments of connection. Relationships are strengthened, a child's perspectives are expanded, social emotional skills can be strengthened, and those moments of connection build early relational health, and those are positive childhood experiences that can lead to resilience to stress later in life as well. And so again, the American Academy of Pediatrics recognizes the power of early shared reading and has developed a toolkit that was just released literally 2 weeks ago. It's called the Books Build Connections Toolkit. Connection stands for not just the neuronal connections in the brain, but also connecting with the person you're reading with and also connecting to the world at large through books. And so the Books Build, and full disclosure again, I was one of the lead editors of this toolkit. And you will notice that we talk about pediatric clinicians, pediatric professionals, rather than pediatricians, because this has a lot of really usable information for all early childhood professionals in terms of choosing great books for children and families, different ages, different needs, differences between electronic books, audiobooks, and so on. And it has a fantastic, even if I say so myself, caregiver section for families with wonderful handouts on specific ages, but also choosing great books for children and raising readers, digital books, other things, and frequently asked questions. So here's an example of the 6-month handout. There's a handout for every single well-child visit. And so there's some great handouts in there that anyone can use. They're free to access for anybody. So in addition to promoting early childhood development, the American Academy of Pediatrics, of course, recommends that we perform developmental surveillance, like Karnesha mentioned early on, at every single well-child visit, and that we do developmental screenings for developmental disorders, autism spectrum disorder, and so on at specific recommended visits. So in terms of developmental surveillance, I use the Learn the Signs Act Early materials, the milestone checklists a whole lot with our families, and find them to be incredibly useful. I didn't realize they could be customized, so we can have my health centers information on them as well. I will definitely be taking advantage of that, but they are so useful to me and our practice. And so I wanted to talk a little bit. I know that the milestones and the milestone checklists were updated about 3 years ago, but there are still a lot of questions in people's minds about how those milestones are different from what they used to be. And so I wanted to take a few minutes to go over that. And actually, before I even get into that, I wanted to mention that the milestone checklists as well have checklists for every single well-child visit age group. And so those are really great for pediatric professionals, but also everyone else to kind of use, for parents to use before they even get to their doctor's office. So, and I know that Deepa will be talking a little bit more about that as well. So one of the big ways in which the new milestone checklists differ from the others, from the old ones, is that now the milestones listed for each age group are those that at least 75% of children would be expected to have achieved by that age. Previously, they used to denote the 50th percentile. So 50% of kids that age would have accomplished those milestones, right? So why did the CDC and AAP work to make that change happen? Because they wanted these checklists to be designed to flag for screening and referral rather than just reflect averages, right? So now if a parent comes in with a checklist and their child is not meeting those milestones, I'm like, oh, I should pay extra attention. Even if this is not a visit where screening is recommended, regular validated screening tools are recommended, I'm going to screen this child anyway. So they are really meant to be used in that way. The other changes that they've made are that they added 15-month and 30-month milestone checklist to coincide with the 15-month and 30-month well-child checkups that the American Academy of Pediatrics recommends. They're available in multiple languages, as Karnesha mentioned. And some things that people have noticed are that some of the milestones have been moved to later ages. Walking alone moved to 15 months, rolling over moved to 6 months, 50 words moved to 30 months. So again, all of these milestones being moved back to a higher age really just reflects the fact that they're now at an age where 75% of kids should have achieved them. And if they're not achieving them, you've got to screen and refer if indicated. Some milestones were removed altogether. Crawling is a key one. And we all know, all of us who've been in the pediatric developmental space know that some kids just don't even crawl. They go from scooting on their butts to just walking, right? And so crawling has been removed. Several other milestones have also been removed. And social emotional milestones have been added for the younger age groups, specifically in the hopes that they might help us identify those kids who are at risk for autism spectrum disorders early. Open-ended questions were added to the list because that opens up a dialogue with the pediatrician or the pediatric care providers, pediatric professionals. So those are great as well. And then, of course, the American Academy of Pediatrics recommends that all pediatric primary care providers perform surveillance at every well-child visit and screen for developmental milestones at the 9, 18, and 24 or 30-month visits, and do autism-specific screening at 18 and 24-month visits. And so the tools that we in pediatrics generally tend to use, the ASQ, as Karnesha mentioned, for development, and the MCHAT, the Modified Checklist for Autism in Toddlers, is the gold standard for autism screening that we use. But of late, the SWIC, the Survey of Well-Being of Young Children, has gained a lot more acceptance, and people all over the place. We switched over from the ASQ to the SWIC in our practice because, number one, it is free. Number two, it covers everything, not just developmental milestones, behavior, autism. It has its own autism screener, which is called the POSSE, or the Parent's Observation of Social Interactions. It asks about parent concerns. It asks about family questions. It screens for maternal depression. So it is it's a one-stop shop for all kinds of screenings that are important for early childhood development. So a lot of practices are moving over that. And despite the AAP recommending these screenings at these recommended ages, there is still a gap in terms of practice. Not a lot of pediatric practices are actually doing those screenings and referring early to interventions, including early intervention. And so, which is why family-led developmental monitoring is so important, as Deepa is going to speak about shortly. But I wanted to end by talking about one more initiative right here in New Jersey, which is led by the New Jersey chapter of the American Academy of Pediatrics and is funded by HRSA as part of their Transforming Pediatrics in Early Childhood initiative. It's called the NJ Seedlings Program, and there's a QR code for you to check out our website. It is a partnership between multiple organizations led by the NJAP, of course, but SPAN and Deepa have been amazing partners in this work. And so the goals are to place a trained early childhood expert in pediatric practices. So we are training those folks, the professionals we're placing, in the Healthy Steps model. And then we are helping practices engage in QI processes to help them integrate a continuum of early childhood services, including developmental promotion. And then we are offering, not just for the practices, but also for anybody in New Jersey, these quarterly learning community sessions, as well as for providers, we're offering echo sessions as well to improve early childhood knowledge and skills. And we are identifying solutions to ensure sustainability of all of these interventions. And with that, I will pass it on to Deepa.
Thank you so much, Dr. Ramachandran. That was fantastic, and a nice segue into what I'm going to be talking about now. For those of you who don't know me, I am Deepa Srinivasavaradan, and I work at SPAN Parent Advocacy Network, which is a parent organization in our state. And as Karnesha mentioned, I am also the proud Learn the Science Act Early Ambassador for our state. And so happy to be here with Dr. Ramachandran and Karnesha to talk about how we can all collectively work together to support early development and positive outcomes for all young children and their families. In addition to all of these roles that I have, I want to emphasize that the first and foremost role I have is that I'm a parent, and that's what brought me to all of this work, and really started me on this path to be able to focus on early childhood development and make sure that families are aware of some of these resources that I was not aware when my son was, young and was in those early years of development. So when I learned about the CDC's Learn the Science Act Early program, obviously I became very passionate about it. As a first-time mother in a new country, we had just moved here from India, and not being aware of these resources really delayed the access to services and connections that my son needed. However, we were fortunate to be connected to early intervention services. We were in Pennsylvania at that time, where early intervention goes up to the age of 5. So my son was able to receive that benefit for a little bit before he transitioned to kindergarten. So all the more reason why I try to emphasize to families the importance of early intervention and the critical window of time that they have before their child reaches age 3 to access early intervention services if they have any questions or concerns related to their child's development. So having said that, I am going to briefly share the mission and vision of our organization. So as I mentioned, SPAN is a family-led, family-serving organization in our state, funded by the U.S. Department of Education, Office of Special Education Programs, to serve as the parent training and information center for our state. We're also federally funded to be the family-to-family health information center, the Family Voices State Affiliate Organization, and we also house the parent-to-parent program, all to say that we help families navigate the different systems that they need to for and on behalf of their children. So our mission and vision is to empower families, youth, and young adults, inform and involve professionals and others interested in the healthy development and education of children. And obviously, our goal is to enable everyone so children and eventually youth can then become fully participating and contributing members of our communities and societies. So we're a one-stop for families. Families can reach us, professionals can reach us. We are always trying to educate, empower, and engage parents. We offer a lot of trainings and professional development opportunities as well for professionals. So please contact us and connect families with us. I have all the contact information available to you at the end of the presentation. But now let's focus on family-engaged developmental health promotion. I'm calling it developmental health promotion because we have been hearing more about surveillance or monitoring and screening, but there's more to it. We want to empower parents with all the steps that they need to take to make this family-engaged developmental health promotion be successful for themselves and for their children. So we want to educate families about the importance of monitoring their child development using milestone checklists, but then also connect them to their child's doctor or other places where they can receive screening. So Dr. Ramachandran mentioned that some pediatricians may not be offering screening to families. So, families do have other opportunities available in our state because our state has widely adopted the ages and stages developmental screening, ASQ, and ASQ-SE, which is social emotional. Families may be able to receive that through their child care resource and referral agency or through the Connecting New Jersey hubs in our state, and through home visiting. So there are a lot of different ways that families can access screening in addition to receiving it through their child's pediatrician. Obviously, we connect families always to their medical home and to their child's doctor. but also make them aware of other places that are and resources that are available to them for developmental screening. So we also know that some families are maybe hesitant to talk to their child's provider or don't know how to start a conversation, and sometimes maybe more comfortable accessing community resources or may end up receiving these community resources. So long story short, from there we want to also support families with understanding the importance and benefits of accessing early intervention services, as well as diagnostic evaluations, if that's an appropriate next step for their family, and also connect them to other services and supports in the community. So with that being said, as the Learn the Science Act Early Ambassador, I promote all of the Learn the Science Act Early resources in our state. So you can see the wide range of resources that are available. I want to particularly highlight the milestone checklists, which are available in the Milestone Moments booklet in the bottom right corner of the slide. This is a compilation of all the milestone checklists that correspond with every well-child visit for a child. And this is in a booklet format for families that may need it as a hard copy, but there are also individual checklists available that you can download, print. Digital checklists are available. And these checklists are also included in the Milestone Tracker app, which is available for download on iPhone and Android phones. The neat thing about the app is that it's very family friendly. Parents can just complete the milestone checklists on their phones. And as soon as they complete, they also receive a summary of the information to share with their child's doctors or other providers who may be supporting their child's development. Highly encourage all parents to complete the milestone checklist prior to their child's well visit. And then there are these amazing children's books, Baby's Busy Day, Where is Where, and Amazing Me, are children's books for children 1 to 3 years of age. And these are available in English and Spanish. And many of the other resources here are available in other languages as well on the CDC website, as Karnesha mentioned. We have been able to customize some of these children's books for our state with New Jersey specific information. We have included our early intervention number, our child find number for children who may be over the age of 3, and as well as SPAN's contact information and Connecting New Jersey hub information for families, so they don't have to go to the CDC website to then be redirected to New Jersey. So we have been able to do some of that work here. And recently we have also been able to customize the English and Spanish version of the Where is Where and Amazing Me book into one book. So we're able to also provide support to families that may need to have both English and Spanish side by side to support early literacy. All thanks to funding from the New Jersey Department of Children and Families and the collective work with Reach Out and Read and SPAN. With that being said, another piece I also wanted to emphasize here for family engaged developmental monitoring is the 3 essential attributes listed here. Families are the experts, and what family engaged developmental monitoring does is provide that holistic picture of child's development. And it's all about the conversations about the child, and that's family centered, right? It's not, so development is discussed longitudinally. It's not just about completing a milestone checklist, or it's not just about accessing early intervention, or it's not just about having a conversation with the child's doctor. It's all of this combined is family engaged developmental monitoring. And we as families and providers have equal responsibility to make sure that families are aware and are in front and center of this process. And I will share the link to this roadmap after I finish speaking. And the best thing about this is it neatly lays out the strategies that providers and families could use to support this family engaged developmental monitoring process. Strengthening families' protective factors. Many of you may be already aware of this, and I don't want to belabor this for everybody, but stress is inevitable. Families with young children often don't know what they don't know. So at SPAN, we take pride in thinking of every parent as a leader, and just that they are not aware of what they need to know. So we meet them where they are. And we, through the connection we can make with these families, we offer the support we are able to offer to help them better navigate the different systems and navigate the impact of stress on their own families. So that being said, again, I talked about the Milestone Tracker app and how it is important to emphasize to families that it's important to watch for their child's development and progress that they're making and celebrate their child's development, but also understand what they need to know when there are concerns. So that's the main focus of the Learn the Science Act Early program and all the work that we do at SPAN. And it's not like we're overwhelming parents here. We're just educating and empowering them with the information and the options that they have available to them to take that next step. And one important next step, like I highlighted before, that we highlight to families is to have that conversation with their child's doctor. And other steps obviously include offering them information about how they can access developmental screening, how they can connect to early intervention or diagnostic evaluation as appropriate. And I did mention the customized children's books that we were able to create in partnership with Reach Out and Read and New Jersey Department of Children and Families. We also house all of these resources related to reading, playing, and growing on our website, on the SPAN website. I'll share the link to our Early Childhood Initiatives page as well, where you can find the information about all of these resources. And the Box Center flowchart is another resource we share with families often to help them understand the next steps that they could be taking and what resources are available to them, including SPAN, the Special Child Health Case Management Unit if they have children with complex healthcare needs. And New Jersey Early Intervention System and SPAN have a long-standing partnership for supporting families. And I'm really extremely happy to share that we have been able to continue on that path of collaboration. So we are currently working together to engage families in developmental monitoring and early identification. We have cross collaboration where early intervention staff and SPAN staff are able to provide joint presentations to create awareness and help families access early intervention services. We also work collaboratively to help families prepare for transition. SPAN staff participate on the early intervention systems transition meetings with families. And we also obviously help your families and be aware of understanding what their rights are and also effectively communicate about their children's needs and help their children develop and learn, which are the family outcomes indicators for the New Jersey early intervention system. So again, the partnership is working, and we are moving right along. We also are members, both the New Jersey Early Intervention System and SPAN are members on the Pyramid Model State Leadership Team, where we were able to train together to facilitate positive solutions for families, which is a 7-week evidence-based series for parents to learn strategies to connect with their own children and be able to support their social and emotional development. We have several members of both the teams that have been trained as facilitators for this. And we also share wait lists with each other. If there are early intervention families waiting to register for the positive solutions for families that the early intervention system is offering, and they have limited space available, then we open it up to those families first at SPAN before we offer it to other families, and vice versa too sometimes. So that, and then I briefly wanted to touch on the Division for Early Childhood recommended practices, which many of you as early intervention providers may be aware of, but for family members who are on the call, I know I'm not going to do justice here, but with the limited time that I have, but these practices are evidence-based and provides guidance to parents and professionals who work with young children who have or are at risk for developmental delays or disabilities. Here's the QR code that will take you to that website. And there are these recommended practices divided into these topic areas. You can see there are specific ones related to the family topic area, but there is something that everyone, families or professionals, or families and professionals, I should say, would be able to take away from and use in their daily interactions with their children. And these are some practice improvement tools based on the recommended practices. Again, you can see there are performance checklists for providers and practice guides for practitioners, but also practice guides for families. And again, there are recommended practices ambassadors across the country. And I'm also fortunate to be your RP ambassador for the state of New Jersey. So happy to answer any questions anyone may have and walk them through the practice guides at a later time. I'll also share my contact information. But this is SPAN's contact information. Connect families with us. We also have a weekly e-newsletter with tons of information that can be useful in your day-to-day work or in your day-to-day support for your own child. So please reach out to us, stay connected. And families can also reach us through the warm line. This telephone number listed up on the top of the screen. And we have family intake specialists who are waiting to take your information and connect you to resources and information. And that's my contact information.
Thank you, Deepa, and everybody that presented today. We are going to take a few minutes to open it up for a question and answer. So if anybody has any questions they want to put in the chat, I'm happy to read them off and we'll see what we can do.
I'd like to address a few things that are already in the chat.
Perfect.
One of them, I hear the concerns that people have about the new checklists, and I did want to address them. The crawling, I don't have a personal opinion on. It's just that it's a milestone that a lot of kids were missing. That much I did know. But one of the concerns that people have is that by moving back the milestones for the number of words, the 50 words, to 30 months instead of 24 months, people have the concern that we're going to miss more kids with speech delays, right? And then so if they're referred only after 30 months, then they have a very short period of time within early intervention. So one of the things that was happening before is that people were doing a lot of the wait and see. Clinicians, pediatricians, as well as families, they were like, oh, well, let's wait and see. This is just, so I think delays in referrals were happening even with the old versions of the milestones checklist. So I think it's a larger problem. And at least now I feel like, especially when I'm teaching, when I'm an educator as well, I'm a professor of pediatrics at Robert Johnson Medical School, it's just easier for me to say to my learners, if they fail the checklist, you gotta take it seriously. You can't adopt a wait and see approach, right? So I just wanted to mention that. And Deepa and Karnesha, feel free to chime in. But I also wanted to talk a little bit about the SWIC. There was a question in the chat about I'm sorry, I have to scroll down to it, about someone who was using the Jennifer Nowak, who said we're using the ASQ and ASQ SE for parents to fill out at your school and wondering if SWIC might be a better option. So I think they're both great screeners. Like I said, for me, the good thing about the SWIC is that it measures so many different things at the same time, especially the maternal depression screens that it has, right? So that's the one reason, especially in a clinic setting, to train every MA, and if someone's out sick, to train someone else to be using different screeners, one for social determinants of health, one for maternal depression, one for milestones, one for social emotional skills, was a lot. And so we just found it extremely useful to like have parents fill out that one screener. And of course, the fact that we didn't need to pay for it in a resourced, strapped, federally qualified health center setting that I work in was a big plus for us. So I like the SWIC. I will make a caveat though. The PASI is not nearly as good as the MCHAT for autism screening. So if I have any, and several pediatricians do both, or do the MCHAT anyway and don't do the PASI part of the SWIC. So I will make that one caveat. So if you have any suspicions or reasons for suspicion at all, an MCHAT would be the way to go.
I would like to chime in a bit. Just so one, I would do want to mention these milestones that were released 4 years ago. And the previous milestones that came about, I think we were released in 2004. They were used from kind of what some people I think do, and they said, well, I think from my practice, from my experience as a pediatrician, what I see is what most children should do by this age, as opposed to now, this is the first time we are using actual documented evidence. Um, and so that is really important considering, the Centers for Disease Control, we are a public health agency. We want to make sure we're using evidence when putting out documentation. So I did put a note in the chat, I think responding to the person who they had a concern about the crawling milestone, which we have heard that. And as I mentioned, we've had these out for 4 years now, and we to date have not received normative data around crawling. And that is something we are absolutely open to, if anyone has access to any of that information, so that we are continually assessing the milestones and making adjustments as needed. So that is something that we do not have, and we only use normative data for this checklist. So I do first want to say that. And then additionally, we kind of rely on providers like you to communicate with parents to let them know, hey, these are milestone checklists. These are not guidelines. These are not standards. They are really a tool to promote ongoing developmental observation and encourage the conversations that it sounds like many of you are already having with families, letting them know, this is a tool to help you know what to do if you have a concern, give you language on how to speak with pediatricians. So it really is not meant to be a guideline or a standard for a provider. And so and I'm happy to give Deepa more language to share with people who might need that when communicating that to families. But it really is a tool to help with conversation, to kind of empower families to have the words to pull from. Even with our app, we have photos and videos for families who might be a little bit more low literacy, so they can even bring it to a doctor and say, hey, my child isn't doing this. This is what this says. What do you think? And then have that conversation around the screening as the next step. So I hope that's helpful. I did include my email address. We're always open to receiving any other feedback. And again, data research that we might not have been made aware of yet.
And quickly to add to what Karnesha just mentioned, at SPAN, we have had opportunities to support parents understand the importance of developmental screening and how they can use the developmental screening results as well. So there have been instances where families were not able to bring up their concerns either with their for whatever service they need to access for their child, whether it's maybe the doctor is using a wait and see approach, or maybe it's the school district where they're trying to request a child study team evaluation, but they're not able to communicate that with effectively. Then we help families access developmental screening and complete a screening tool for their child. So then those results are more comprehensive, and they have something to show to these programs or providers to say, hey, my child has these concerns, and it's not just me noticing these concerns, but I have proof of that, right? So that's also helpful sometimes to empower the parent to be able to start a conversation and engage in that conversation.
Yeah, I think the point is very well taken, though, that we all, in all our fields, need to be doing a better job at identifying children early. So empowering parents, which is why the NJAP is really doing this big initiative here to educate providers, all clinicians, in early childhood development and screenings and placing extra people within practices to help with all of that. So I think that point that I'm seeing in the chat box that's being raised is a very valid concern, and we, all of us have to be doing a better job.
I think at this point it is 2 o'clock, so we are going to end. Everybody's contact information was put in the chat, I believe. And if you go back into the lobby, once you sign out of this room, we're going to go into our closing reflections and the last portion of our day. Thank you all for coming and for all the wonderful information.